Facts about the reproductive system. Approximately 100 million acts of sexual intercourse each day. Sperm count of an American male compared to 30 years ago is down 30%. Tell you why. It has something to do with Puffin the Magic Dragon. Men sweat more than women. Women can better regulate the amount of water they lose. Their average amount of time spent kissing for a person in a lifetime is 20,160 minutes. The condom made originally of linen was invented in the early 1500s. Casanova, the womanizer, used linen condoms. It's an interesting fact. Sex burns about 70 to 120 calories for a 130-pound woman, 77 to 155 calories per 175 pound every hour. That's a lot of work to burn off one flour tortilla, wouldn't you think? Impotence is grounds for divorce in 26 U.S. states. Marijuana causes this. Marijuana also causes your sperm count to be lower, so there you go. Some extra reasons why not to smoke marijuana there. Kissing can aid in reducing tooth decay. This is because the extra saliva keeps the mouth clean there. During the female orgasm, endorphins are released, which are powerful painkillers, ladies. So headaches are in fact a bad excuse not to have sex. During World War II, condoms were used to cover rifle barrels from being damaged by salt water as the soldiers swam to shore. And we mentioned this before, but dolphins and the bonobo chimps are the only non-humans that have sex for fun. Every other creature, species only has sex for procreation, but only humans, dolphins, and bonobo chimps are the only non-humans that have sex for fun. And then penguins engage in female prostitution to get what they want. That's right. You see these dolphins, these penguins, all these animals you think are nice little cute little things, but they're very hostile. All right. So there's 2 sexes. Sexual reproduction involves 2 parents, of course. And one, you get 23 chromosomes from mama and 23 chromosomes from papa. Gametes are sex cells. Males have sperm. Spermatozoa has motility for achieving contact. And females have the egg, has nutrition for developing the embryo. Zygote, fertilized egg. Males have Y and X chromosomes. They have a penis for introducing sperm. And females have 2 X chromosomes. They have the vagina for receiving the sperm. All right. Primary sex organs for males are the testes, where sperm are produced until they die. So males have an infinite supply of sperm. Females are ovaries, and the eggs, they're not produced there, they're stored there. And this is a very important concept. So at birth, females, approximately 1 million eggs. At birth, this is the key. By the time of puberty, though, only about 300,000 remain. And of those 300,000, only 300 to 400 will be ovulated during a woman's reproductive lifetime. So fertility can drop as a woman ages due to decreasing number and quality of the remaining eggs. Okay? And so of those 300 to 400, if you were to get pregnant one right after the other, you have the potential to have about 36 to 40 kids. So you want to keep that in mind. Remember, at birth, you have about 1 million eggs. But by the time you reach puberty, females, you only have about 300,000. And of those, only about 300 to 400 will actually mature and be ovulated. So those are some key characteristics there. The difference between male and female. Actually, it only takes 1 male to populate the entire Earth. Can you believe that? Some secondary sex organs, males, duct, glands, penis, the female, uterine tubes, uterus, vagina. You have internal, external genitalia, and secondary sex characteristics. So I'm going to show you a video that kind of explains meiosis and the difference between meiosis and mitosis. Earlier in the semester, we talked about mitosis, which is the duplication of a cell into an exact daughter cell, which is an exact copy. But if you have a cell that has 46 chromosomes and you find another cell that has 46 chromosomes, well, that would be 92 chromosomes. And that would not be a human, because a human definition of human is 46 chromosomes, right? So we have to find a way to take those 46 chromosomes and break it down to 23, and then 23 for mama. So those are, and when we break it down from 46 to 23, those are the characteristics that might get handed down. So you might have your dad's curly hair or your mom's brown eyes, because when we're breaking down the 46 chromosomes down to 23, those are the characteristics that kind of carry over. So let me show you a video. All right, so external and internal genitalia. The male has the penis and the scrotum. The female equivalent to the scrotum, labia majora, labia minora. Females also have a mons pubis. They have a clitoris. The corpus cavernosum in the penis is equivalent to the female clitoris. You have a vaginal orifice. You have vestibular bulbs and vestibular glands that help secrete a fluid for sexual intercourse. And then you have the periurethral glands. So all these glands will produce a fluid that will lubricate during sexual intercourse. Internal genitalia for males, you have testes, which produce the sperm. You have the epididymis that stores the sperm. You have the ductus deferens, or the vas deferens, that takes the sperm from the testes out to the environment. You have seminal vesicles, that 60-70% of seminal fluid provides nutrition for the sperm. Basically, this is what semen is made out of. It's got vitamins, antibacterial properties, and alkaline fluid to prevent the sperm from dying off when they go to the acidic environment. Prostate gland also contributes to the seminal fluid. All right. Internal genitalia for the females, you've got the ovaries. You have two of those, the uterine tube, two of those, the uterus where babies grow, not in the stomach. Babies grow in the uterus, and the vagina for receiving the penis. All right, so let's take a look at this male reproductive system here. These are the two layers. You have the corpus cavernosum. Here's the corpus spongiosum. As you can see, the males share the urinary system and the reproductive system in one opening. Here's the testes. Here's the epididymis, where store and sperm are matured. Here's the vas deferens. That is a gateway for the sperm to go from here. Here's the seminal fluid, which will contribute to the ejaculatory fluid. Then it's going to go through here. Here's the prostate gland that will actually produce a fluid that actually releases an antibiotic to prevent UTIs in males. And this is a very interesting bulb right here. It's called the bulbourethral gland. You might see it as Cowper's gland. And the sole purpose of this gland is to cleanse the urethra of the acidic urine. Because if it doesn't produce this pre-ejaculatory fluid, what will happen is as soon as the sperm come into contact with the acidic urine, they'll all die off. And remember, the sperm are going to an acidic environment to begin with, so we need to find ways to alkalize or neutralize the acidity. And the seminal vesicle, the prostate gland, and the bulbourethral gland help in doing that. So again, the bulbourethra cleanses the urethra of urine, trace amounts of urine, so that when the sperm come, they're not going to get killed by touching the acidic urine. So the sole purpose, or now you know, that pre-ejaculatory fluid is mostly urine. FYI for the day. This is urinary bladder. Here is the rectum. Here's the anus, and that's the sigmoid colon. Here's another view. Two testes, the epididymis, look like little caterpillars. Here's the vas deferens. Here's the urinary bladder, the seminal vesicles that sit right here. Here's the prostate gland that as you get older can get enlarged and can cause constriction here. Then that means the bladder will no longer get empty, so males get the feeling that their bladder is always full. And here is, all right, so here's the scrotum, pouch that contains the testes, medium septum. All right, you got the perineal raphe, external seam, the spermatic cord, which houses the blood vessels and the nerves, ductus deferens, nerves and vessels. You have an inguinal canal. Now remember, males are more likely to get inguinal hernias because remember, when the descent of the testes occurred, it actually produced a little bit of a weakness right in here. Okay. Temperature regulation, you have the cremaster muscle, which causes the scrotum to rise or descend depending on the temperature. You have a dartos muscle, which is a smooth muscle that wrinkles the scrotum. And then the paniform plexus, which is a vein network up the spermatic cord right here. Okay. All right, testes, also called the testicles, not Rocky Mountain oysters. Those are bull's testicles. Connective tissues, tunica vaginalis, tunica albuginea. There's hundreds of lobules of 1 to 3 seminiferous tubules. Germinal epithelium, germ cells become sperm. Nurse, tentacular cells help make blood testes barrier. Interstitial endocrine cells between the tubules make testosterone, so this is where testosterone is produced. And the reti testes is the sperm mature in this network here. Here's the testes here, head of the epididymis. Okay. Here's the seminiferous tubules. And this is where testosterone is made. Okay. So if you look at these little reti testes, this is where the sperm mature, and then they can actually hang out in this epididymis for about 21 days. Now, spermatogenesis is interesting. I'll show you a video on this. Type A spermatogenesis undergoes mitosis, forming one type A and one type B. Okay, so here's 2N, 2N meaning 46 chromosomes. We need to find a way to get 46 chromosomes to 23 chromosomes. Okay, so type B spermatogenum become primary spermatocyte, so it goes from here to here, forming 2 haploid secondary spermatocytes. Okay, so it's going to go from here, and now the 46 become 23. The secondary spermatocytes undergo meiosis II, forming 4. So now these are going to split even more and go into, so one's type A spermatogeneum will actually produce 4 viable sperm. And these all have different characteristics. Even though this is, let's say, the father, this one can have certain characteristics. This one might have other characteristics. So that's why 2 parents can produce different looking offspring, because when they go in through spermatogenesis and oogenesis, well, different characteristics can come to the surface of the offspring. So again, spermiogenesis, appearance of acrosome vesicle and flagellum, right in here. Here's the flagellum. Growth of the acrosome and flagella here. Shedding of the excess cytoplasm, we don't need that. And then there's the mature sperm. Each ejaculation has about 150 million sperm, and all it takes is one critter, one guy here, to find the egg. Spermatozoon, head, nucleus, acrosome, lysosome, flagellar basal body. The tail mid-piece, they have many mitochondria because it's got to go swim up this treacherous hill to get to where it needs to go. Show you videos on that. Spermatic ducts, efferent ductules, posterior testes carry sperm to the epididymis. You have the epididymis, which is the head, body, and tail. Sperm storage and maturation. You have the ductus deferens, long tube with smooth. Ampulla is widened on the last portion. Now, what you can do is you can have, males can have a vasectomy, which basically cuts ties from where the testes are to the ejaculatory. So there would be no sperm in the ejaculatory fluid. So you're shooting blanks if you cut the vas deferens and have a vasectomy, which you want to make sure you make that decision because it's very hard to reverse. But ejaculatory duct passes through the prostate, empties into the urethra. Urethra, prostatic, membranous, spongy. So the accessory glands of the male, again, the seminal vesicles are a pair of glands, posterior to the gland. They empty into the ejaculatory fluid. Duct that contributes about 60% of the seminal from the seminal vesicle. The prostate gland surrounds urethra and ejaculatory ducts, empties in the urethra. 30% of ejaculatory fluid is from the prostate gland, also contains an antibiotic. And the bulbourethral gland, pair of glands near the base of the penis, which secretes clear fluid that neutralizes urethra and lubricates the head, and that's about 10%. Okay? So, I'm sorry, not 10%, just cleanses the 10% of the sperm. Sorry about that. And then each ejaculation is 2 to 5 milliliters per ejaculation. So a sperm count can be anywhere from 50 to 120 million per milliliter. If you're having 5 milliliters per ejaculation, That's a lot of sperm that are deposits, and all it takes is one. So the penis in a nutshell, here's the dorsal vein, dorsal artery, here's the corpus cavernosum. Again, the corpus cavernosum is the equivalent to the female clitoris. It's the same tissue. Corpus spongiosum surrounds the urethra. Okay. All right. Take a little break, and then we'll talk about the female. All right, class. Now we will start the female reproductive system, which will take a little bit longer. So let's go from anterior to posterior. So we've got most anterior, you've got the mons pubis, the labia majora and minora, that's the equivalent to the male scrotum. Okay, the area here, right here from the clitoris to the vagina is also known as the vulva. Okay, here's the vaginal orifice. The vagina has rugae as well. Okay. This is designed to receive the penis. I mean, it's elementary, but I do have to say it in educational terms. All right, here's the clitoris. This is made out of corpus cavernosum, which is the equivalent in the male penis. Here's the urethra. Here's the bladder. Now, as far as UTIs are concerned, you can see that the length of the urethra is a lot smaller in females, therefore they're more prone to UTIs here. Okay, and we talked about UTIs in the urinary system, but you can see the close proximity of the vagina and the rectum. So if poor hygiene, if you're wiping from back to front, well, you introduce E. coli from the anus into the vagina and into the urethra, right? So UTI is a urinary tract infection, so you've got bacteria in your urinary tract, not in your vagina. But although during sexual intercourse, you can drive the bacteria into the urinary bladder as well. So pee before, pee after, practice good hygiene, and you should be able to prevent UTIs. Now, unfortunately, in the hospitals or nursing homes, nurses are sometimes notorious for giving patients UTIs because they have a tendency to hurry up and wipe too quickly, and then, or sometimes the patient will just be basking in their own urine and feces because they wear diapers and someone didn't get a chance to come and help them. Again, okay, here's the uterus. Now you have this mucosal plug that covers the uterus for about 26 days. Okay. So really no sperm can go into here. Around ovulation time, what happens is thick mucus actually starts to become a watery mucus, and ladies, this mucosal plug will actually get released. So you usually can notice that, and usually that's when you're ready for ovulation. So when this releases a mucosal plug, you'll be able to, the sperm, if the sperm are introduced during that time, they'll be able to travel up the uterus, up the fallopian tube, and if the ovum has been released, and then basically you can make a little bambino. But the timing has to be right. And then again, ladies, you can only get pregnant actually 2 days out of the entire month. So let's say you started, and we'll talk about the menstrual cycle and the ovarian cycle, what days you can actually get pregnant. But it's actually pretty hard to get pregnant. The reason that young people get pregnant so quickly is because they're doing it all the time, morning, night. So if you're doing it all the time, obviously you're introducing sperm into the vaginal orifice, and the sperm usually lasts about 48 to 72 hours. So they're just hanging out, waiting for that egg to drop. All right. It's kind of like waiting for Supreme sweatshirts to drop. You guys ever buy Supreme sweatshirts or shirts? Gotta wait for that drop on Tuesday. Some of you know what I'm talking about. Oops. All right, so here is the vagina here. Again, here's the cervix. So it usually has a mucosal plug, and the sperm have to travel up the vagina through the cervix all the way here. And then here's the ampulla, which is a wider opening. Again, so when you release that egg around the 14th day if you're regular, and then Mr. Sperm is waiting for you, then you'll fertilize the egg, become a zygote, and come down here. Okay. All right, so you have ligaments that hold the uterus in place. You have ligaments that hold the ovaries in place so that they don't fall out. Sometimes, though, as you get older, actually, for some ladies, the uterus can actually fall, and you get a prolapsed uterus, and that can actually fall through the vagina, and you can actually see it. Not too pleasant, not too common. So you have two ovaries. Again, they have tunica albuginea, which is a capsule. Remember that tuba albuginea is also found in males. Medulla, fibrous connective tissue with blood vessels. Cortex contains ovarian follicles. Follicle contains egg and supporting follicular cells. Ligaments of connective tissue. You have the ovarian ligament, medial attachment to the uterus. Suspensory ligament, lateral attachment to the pelvic wall. Mesovarium, broad ligament, vertically oriented sheet of peritoneum. Okay, so those are all ligaments that hold the uterus and ovaries in place. And then, of course, you have a vast blood supply ovarian branch of the uterine artery and ovarian artery. Here is the structure of the ovary. So you have these primordial follicles. You have 300 to 400 of these. Okay, so, and of these primordial follicles, remember I told you, only a handful will actually get released every time of the month. Okay, so here's the tunica albu. Here's the corpus luteum, which will play a role if the egg is released. It will release estrogen and progesterone, and if the sperm matches and fertilize the egg, then it will continue to release progesterone and estrogen, and that's how it will nourish the baby. Now, if you don't get Mr. Sperm to be right there, then the corpus luteum albicans. Now, birth control works the same way that corpus luteum does, in that it releases a steady state of progesterone and estrogen so that your body thinks that you're pregnant. Okay, so depending on which pill you take, some of them are estrogen progesterone, the combo pill, some are progesterone only. Basically, it tells your body that you're pregnant, so it will not release any more eggs, and therefore you can't get pregnant. Pretty simple. You can still get STDs because it doesn't prevent you from STDs, but it will prevent you from getting pregnant. All right, so oogenesis and corresponding development of the follicle. So before birth, here's the egg. Okay, so it's mitosis. Okay. And then adolescence to menopause. Okay, so from birth to about adolescence, ladies, you take a little break. So nothing happens really as soon as you're born to until you hit puberty. Nothing's happening with your eggs. Okay, so then once you hit adolescence, which is menarche, which is your first menstrual cycle, it can be as early as 8, 9, it can be as late as 13, 14. So it just depends. Okay, then it will basically the primary oocyte, the primary follicle, then you get a secondary oocyte. Then the secondary oocyte can basically split. One of them will die off, and then so this remains 23, okay, 23 chromosomes, and then it'll become, if it's sperm, then it becomes 2, so 23 plus 23 zygote, and I'll show you a video on this, how this occurs. Okay. Again, oogenesis, which is the production of the female gamete, not game. Ladies, you always have game. Begins in the fetal period. Oogania, diploid stem cells divide by mitosis to produce primary oocytes that undergo meiosis 1, secondary oocytes that undergo meiosis 2, and then the ova, which is released every 28 days. What's the major difference between oogenesis and spermatogenesis? Well, the production of primary oocytes occurs only in the fetus for ladies. In primary oocytes, meiosis is arrested in late prophase 1 and resumes only years later. So for some, remember it takes that break. And in secondary oocytes, meiosis is arrested in metaphase 2 and is only completed if fertilization occurs. So ladies, you have a 3-step process in how your eggs are produced and released. Again, you are born with about 1,000,000 eggs, and about puberty you'll have about 300 to 400 that can be released. Okay. At birth, female presumed to have a lifetime supply of pride, so you can't make any more after you've been born. So again, at birth, you have approximately 1,000,000 eggs. Okay, 1,000,000 eggs. But by the time of puberty, you're only going to have about 300,000. But of those 300,000, only 300 to 400 will be ovulated in your entire lifetime. And that doesn't mean you can have 300 kids. That's impossible. It's just some of them will get lost in the peritoneal cavity. Sometimes you're not going to. So physically, you can have about 36 to 40 kids. So remember that, and that's it. Remember, you have a finite number of eggs. So your OB will tell you that, hey, you have 1,000,000 eggs, but of those 1,000,000 eggs, none of them, you can't have 1,000,000 babies. That's ridiculous. Okay, so I want to make sure you have the right information. All right, so what's the difference between spermatogenesis and oogenesis? You have total time to produce one gamete is 74 days. For ladies, it takes you 13 to 50 years to produce one. Okay, that's basically your menstrual cycle. Currents during lifetime, basically from males, once you hit puberty, you keep making them till old age. For females, it begins in fetal life, but ends in menopause, so no more eggs after menopause. One will split into 4, one will split into 1. The other 2 to 3 small bodies, they will die off. Number of gametes that you make per lifetime, so one male makes over 1 trillion gametes. Ladies, you make less than 500. I think I told you 300, 400 is about average. What's the error rate? Because males make so many, the error rate is less. But ladies, since you only make a finite number, your error rate is 20%. So unfortunately, a lot of times, sometimes the genetic defects or the inability on the mother's side. But it could be a male issue as well, but you can see the ratio of 5 to 20%. Cells surrounding gametes, you have 1 cystinocyte and spermatocytes, and then the female many granulocyte cells sustain 1 oocyte. All right, so let's talk about the ovarian cycle. The ovarian cycle is roughly 28